All right, let's see. And we are live. Happy Saturday, everyone. This is the voice and the face of Dr. Tolu Olabinto. I help patients live long and well because I believe the quality of life is just as important as the quantity of life. If you are joining us live, you know what to do. Hashtag live. If you're joining us replay, hashtag replay. You have friends, family who should be watching this, who you know this will be helpful for. Please tag them in the comments or simply forward this video to them. I'm excited today. I'm always excited, I'll be honest, but I'm really thrilled to be having this discussion today. And our topic is tips on how to care for your pelvic floor. And I have the honor of having as a guest today, Dr. Folusho Stephen, who's also known as Dr. Foley. He's an OB-GYN, he's a pelvic medicine, a female pelvic medicine and reconstructive pelvic surgeon. He does a lot of things, and I'm going to let him introduce himself because he does a lot of things. Doc, thank you so much for coming, and I'm thrilled and delighted to have you on.
Thank you, Dr. Olabinto, for having me. Can you hear me? Just want to make sure that
I can hear you crystal clear. So this is
perfect.
Good.
So thank you for having me. Yes, I'm a urogynecologist. I've been in practice for 20 years. I did my training in New York City at New York University, did my in OB-GYN, delivered babies and did the full spectrum of GYN care as well. And then I decided to specialize in urogynecology, which is female pelvic medicine and reconstructive surgery, essentially taking care of women and their pelvic floor issues. And so I don't deliver babies anymore. I just take care of the conditions that affect women that are not easy to talk about, but are very common, such as prolapse, bladder leakage, urinary incontinence, bowel leakage, constipation issues, recurrent bladder infections, pelvic pain, painful intercourse, the things that affect women after they've had their babies. And that, you know, a lot of them will say, okay, why is this happening? Why am I feeling? I see women for those things. I like to tell women that they don't have to live or put up with these. Yes, they're common, but they're good solutions and options. So I like to take care of women and give them a better quality of life as a result.
I love it. I love it. I'm sure those who are watching are like, yeah, we love what you do. We're thankful that you do what you do. But Doc, why do you do what you do? I always like to ask the story behind your journey here.
Yeah. So, you know, initially, again, as I mentioned, I went into OB-GYN because I loved women's health. I'm a married man, a wife of 21 years. I have 2 daughters, a great mom and sister. So I've kind of been surrounded by women. And I think for me, taking care of women has always been part of what I saw myself doing to contribute back to the world. And so that was my initial goal, was to, you know, take care of women as part of my medical career. But along the way during residency, I was like, oh, okay, I do like to sleep through the night. I work hard during the day, but I do like to sleep through the night. And I love babies, but I kind of wanted to focus more on the surgical aspects of my field. And through my training, my mentors, they really honed that aspect of my skill set. And so surgery became my passion. And so I did then decide to specialize in female urology, or urogynecology, it's called, and reconstructive surgery. And so now that's what I essentially do. I take care of women and I share the various options that help them maintain a healthy pelvic floor. And to be honest, nobody wakes up and says, oh, I want surgery, right? And so thankfully that's an option. But I also like to emphasize to my patients that they've got a lot of preventative options and things that can be put into play lifestyle-wise that are so important, so that we can avoid medication, so we can avoid surgery if we can. And so it just gives me so much joy to be able to educate women in that manner every day.
Awesome. Now, we've used the word pelvic floor, of course, it's in the topic, and you talked about it too. For those who are watching who are like, I'm not sure I have pelvic floor. What is a pelvic floor, Doc? What is that?
Right. So I know we use pelvic floor. That's kind of a general term to mean, you know, the group of muscles, nerves, ligaments, blood vessels, connective tissue that supports a woman's organs. So her gynecologic organs, the uterus, the cervix, the bladder, the urethra, they're a group of structures that support a woman down below. So it is, again, made of muscles, nerves, blood vessels, connective tissue, ligaments, and they all help to maintain tone to provide support so that a woman can feel like, okay, she's well supported. She doesn't feel like there's something dropping or falling out, and she can go to the bathroom, have bladder control, and not feel like she has to run to the bathroom or leak before getting there. And so, or when she's having a bowel movement, she can feel like she's emptied and not feel like there's something still there. So that's the pelvic floor muscles and structures, and they help to maintain the tone to a woman's pelvis.
All right. It's like a, like a.
And you see me do my hand like this. It's like a basket of, well, it's like a basin of muscles that goes from front to back, side to side. So I like to tell my patients from pubic bone to tailbone and from side to side between the hips.
Okay. Now, I'll be honest with you. One of the things I see in conversations with clients and with patients, my women, my female patients, they're like, they don't bring it up as a concern. And as I start to ask questions like, oh, why don't you exercise? They say, well, then, there's a leak. Or I ask them questions like, oh, how come you haven't tried this? Or they talk about their dreams or what they saw themselves doing. And I ask, where's it? Sometimes, when I cough, when I laugh, like it comes out in other ways. So I've learned to ask, especially during the gyne exam. But Doc, I want you to, for those who are watching, are there,
I'm so sorry, my phone was in the background.
That's okay.
let me take care of that. I apologize.
No worries. Some of us want to see the said dog so we can see the culprit is.
Thank you. My wife just took care of me. My golden they're like babies. Yeah.
All right, cool.
I'm so sorry.
No worries. So my question is, for those who are watching, what are things that you would say are signs that the pelvic floor is not quite what it needs to be to help improve quality of life?
Yes. So oftentimes women, so I get this question, how did this happen? Why did this happen? So one of the risk factors for what we say maybe pelvic floor dysfunction or issues with the pelvic floor, a lot of women start to notice this, honestly, Dr. Lagbaton, when they start having children. So having children is a risk factor, particularly vaginal delivery, more so than C-sections. Women who have C-section can also have issues with their pelvic floor support, bladder, bowel control, or can develop prolapse, but it's much more common in women who've had mainly vaginal deliveries. And let's see here, repetitive heavy lifting over a lifetime, straining, constipation, putting additional pressure on the pelvic floor. Smoking can weaken and accelerate the aging process. So that can increase the risk of prolapse. So various things. And of course, we live on planet Earth, there's gravity. So we already have those effects on the pelvic floor, but then those added lifestyle choices along the way compound on that. And so to answer your question, yes, those women may start to notice, they feel like fullness down below. They feel a falling out sensation. I've had even patients and women tell me they feel like they have a tampon in place where they don't have one. So they feel like things are not supported as they should be. There's leakage, either during the day, they don't make it to the bathroom on time. They feel the urge and they just don't make it there. Or some women may leak with laugh, cough, or sneeze, or lift or jump or exercise, those kinds of things. Or may just excessive straining during times of bowel movements, or even emptying the bladder, having to lean forward or lean back or to press down below on the pelvis. All of those things, women start to notice that, why do I have to do that? I never had to do that in my 20s. All of a sudden in my 30s or 40s, when I have had children or I'm older now, why am I, what? So the beginning changes, those are the beginning changes. And it's very important for women to recognize these things and have it addressed and looked into before things get worse.
Okay. Now, you said risk factors, having kids, but people here are like, well, I've had the kids, I've done the things, what is possible in your world? Because you see this patient. So, and I'm saying this because some people have said, well, I guess this is part of aging. This is normal for me. I'm stuck with this. I just have to accept my fate. But I want us to talk a little bit about what is possible. Like, how can quality of life be improved by the things you do, Doc?
Right. So, so a lot for many women, choosing not to have children is not their choice. They want to have children, those women who choose to. And so that's a risk factor that can't be avoided. But that doesn't mean that's the end of the road. So what needs to happen is women, after they've had their children, as in their especially younger women, as they have their children, is to work on their pelvic floor muscles in between their children, or right after that delivery. Of course, there's a new baby, and this is in your world, in your practice, there's a new baby and there's so many new responsibilities. But what a lot of women do graciously is that they put everything above themselves, right? And their families, their babies, and their but it's important to pay attention to yourself and strengthen your pelvic floor after the delivery, because that's the best time to recoup the strength of the pelvic floor, right? And so prevention is better than cure. Rather than waiting 10, 20, 30 years down the line to fix something that was, could have been addressed earlier, it's important to do pelvic floor muscle strengthening. We call it Kegel exercises after their children, to perhaps even see a pelvic floor physical therapist during that postpartum period. That will be the time to regain that muscle strength, that muscle tone of the pelvic floor, so that before the next child, if a woman is choosing to have more than one child, or before going back to work perhaps, or in the process of healing from that pregnancy and from that birth, that is part of the healing process, your pelvic floor. And I think that's very important for women to know.
Oh, I like that. So for those of you, sorry, I know some of you are much older and this is like, woo, we pass all of that. But if you've had a baby recently, really important, it should be part of the package for your postpartum care. So you want to look for a gynecologist, OB-GYN that also offers that. And you want to ask for it because you're one of your best advocates, right? So this is very, very good. Now, okay, so outside of, having children, what are other lifestyle factors that contribute to pelvic floor weakness and urine leaks, so that we can encourage our patients not to do them?
Right. So I think definitely just like a woman who will go to the gym or perhaps, work out to stay strong, doing pelvic floor exercises is important. So when women don't exercise that muscle, it's almost like a use it or lose it, that kind of a thing. And so I think avoiding or not keeping up with strengthening the pelvic floor muscles is a key thing. The other one that we see for some women who are smokers, we know that smoking, amongst many other things, is linked to accelerating the aging process, right? And so women who smoke, they notice they're at increased risk for incontinence and even bladder cancer. That's another topic. They're increased risk for pelvic floor dysfunction because the acceleration of the aging process. Let's see, heavy lifting. I tell my patients, your children, your grandchildren, that's probably the exception, but it's not like a woman shouldn't lift or do anything, but I like to kind of I think in pictures, maybe because I'm speaking to you. And so I kind of give a picture of like furniture, big bags of mulch, bricks, like really strenuous things. And there's no magic number, but if a woman has to really strain to lift that, and it hurts, then it's probably shouldn't be done. I say those things, take care of your kids, but pay to do that, or have someone else, take care of the really heavy stuff. Let's see here. Those are the main things. And of course, there are things that can cause, amongst, excessive intake of things that can cause more urgency, like, coffee, tea, sodas, sugar, artificial sweeteners, alcoholic beverages, carbonated juices. Those things can increase the risk of women feeling urgency, not making it to bathroom on time, and then leakage at times.
Okay. I'm going to say that I was on a talk with Dr. Foley, and I'm not supposed to lift the thing. So I got to protect my pelvic
floor. Right. That's a good excuse. Yes.
Now, for those of you who are watching who are like, man, they don't know my life. Well, here are a few tips. Especially as mothers and grandmothers, we feel the need to always do to show people love. You can just be. You don't have to always do. You can sit and have the kids sit next to you and have them sit on you, so you don't have to do the lifting. So you're still being present with your loved ones, but you don't have to. It doesn't have to cost you that much. That's a mindset shift that I think will help us. You can just be. You don't always have to do. All right. Now, for those of my patients who are watching, clients who are like, okay, I get it, the pelvic floor exercises. But can we talk about aging? So what impact does aging have on pelvic floor function, and how can I know you talked about it already a little bit, on the pelvic floor exercises, but for someone who's in their 70s, we're like, okay, I'm aging. I didn't do the things then. Are there things I should do now? Should I talk to my doctor? How do I even bring up that conversation?
Right. That's a very good question. Yeah. So, I always tell my patients that we live on planet Earth. and so gravity takes effect, and no one's getting younger, right? So we don't have, there's some things we have no choice in the matter. But I still tell my patients, and in fact, there are some women who tried the Kegels, they've done the things, and it hasn't been helpful. A doc, I've been Kegling all my life, and it doesn't help, and I get it. And this is the time where I like to reassure women that you don't have to live or put up with it. There are good solutions, good options that are safe and effective, but it's important to talk about it. Oftentimes bring it up, because sometimes the doctors may not bring it up, but it's important to bring it up and to seek care. And that's where I actually encourage women to speak to a urogynecologist. I think seeing a specialist in this area at this point is key. You've done the things, you've lived done the lifestyle things, but if the symptoms aren't getting better, if they're persistent, then the option shouldn't be to live with it. That's when to see a urogynecologist, a board certified urogynecologist. And like myself, there are not that many of us, in the country, but I practice in Atlanta, Georgia. But that's important to see someone, because we have the training to look at, hone in on what the risk factors are, hone in on where your pelvic support is. And during the physical exam, it's more than just the regular GYN exam. It's really an evaluation of pelvic support, muscles. There could be prolapse. There could be weakening of the bladder and or uterus or the vagina or the rectum. And so it's important to recognize that, because some women will say, I've tried this, I've tried that. Some women may even have tried medications and they said it hasn't helped me. And they told me, the surgery doesn't work, or they told me, it's gonna come back. So all of these, and a lot of that information isn't actually true. And so seeing a board certified specialist urogynecologist is key to nip things in the bud and to get you better, if all the other lifestyle things have been helpful, so to speak.
All right. And I want to emphasize the key word, urogynecologist. That's the specialist you're looking for. Please, I want to encourage you to advocate for yourself, ask for it, ask for things that help improve your quality of life. And I always tell people too, to always ask in terms of, this is what this is preventing me from doing.
Correct.
I'm not able to do this because of this, because that helps prioritize it in the face of the specialist you're seeing, right?
Yeah, and I tell women, yes, because women are, active, and a modern woman wants to be able to do a lot of things and enjoy her family and exercise and travel. And some women have told me they've stopped going to the gym, they've stopped wearing those clothing, they've stopped hanging out with their friends, they don't go dancing, they don't go to church, they don't go to worship service, because they're afraid who's going to be looking at them, going to the bathroom. They're afraid they might leak if they don't get there. I had a woman say she doesn't even get on a plane to fly to see her grandkids, because she doesn't want to leak on the plane, or doesn't want to leak in the bed when she gets to the in-laws. I mean, just a myriad. And you can imagine how much this can affect a woman. So I think definitely seeking help from a board certified urogynecologist is key to get you better and to improve your quality of life, so you don't have to cut back from doing the things you enjoy, because that is part of life quality.
This is big. You are offering hope. For those of you who are watching, you have friends, even your friends that you don't know whether they need this, forward it to them. You don't know who this could help encourage. You're offering hope that there is a better way. There are options. Sometimes you have to ask. A lot of times you have to ask for what you need. Now, my next question, Doc, is this. Now, some people are like, whoa, it's already rough for me to go see the gynecologist, and you're saying this is a more in-depth exam. And so there's oh my goodness, how do I prepare? I've had patients who come for pelvic exams who are like, I'm sorry, I didn't shave, I didn't do this, I didn't do that. Can you help address that, as rated G as you can? To encourage people that it's important for their health, overall health, that they do this, and how do you encourage patients who have this concern?
Yeah, so I encourage my patients that, you're not alone. There are many women who experience this. It's been estimated about 25 to 40, 50% of women. So I kind of give the analogy, imagine, one of every two of your girlfriends or friends have this. Up to 50% of women have one of the many conditions that affect the woman's pelvic floor. So you're not alone. There are good solutions and options that can be helpful and improve your quality of life. So I tell women not to blame themselves, but to seek care. And yes, you have to be an advocate for yourself. But yeah, there are good solutions. I talk to women about this all the time, whether it's an office-based solution, it could be lifestyle changes. There are even things in the office, devices that can be fitted to help to provide support, like a pessary that is kind of shaped like a there are different shapes and sizes of pessaries, but they're almost like a diaphragm, but it helps to support the pelvic floor, and that has been helpful for women. Some women we refer for pelvic floor physical therapy because we have a relationship with many pelvic floor physical therapists that, oftentimes once a week for about an hour over the course of 2-3 months, an investment of time to help to improve the pelvic floor. And some women who are younger maybe can choose to do the exercises at home themselves if they are, if they find that making it to a physical therapist, they don't have the ability to based on time or distance. But then lastly, there are surgeries. After women have tried the things, there are surgeries that can help. And rather than living with it, I tell patients, look, this is an hour, maybe 2. Sometimes there are procedures that I perform on patients they take 15 minutes, that take half an hour. And they have a quality of life. I mean, it's like night and day. I've had women say, well, it's like night and day. They go home after their 15 or 30-minute procedure and they stop leaking, right?
Wow.
A lot of the surgeries that I'm able to offer are minimally invasive. So it could be either a vaginal procedure or a laparoscopic robotic procedure. I've been performing robotic surgery for over 10 years, over 1,500 robotic procedures. So it's minimally invasive. And a lot of women go home the same day. And after a few short weeks, women are back to their lifestyle, either work in the home or out of the home, and they feel better. They wish, I wish I'd done this sooner. I wish I knew. And so that's what gives me that's why I'm so passionate about this, because I get to improve the quality of life of not just women, it's her ability to take care of her children, her family, being the woman she wants to be, whether it's in the workplace or in her business. So it's awesome.
Awesome. So those of you watching, imagine the things you're able to do when less leakage, the things you're able to venture. Sometimes I'm a little cautious about, I want to encourage you to exercise more. And I'm like, okay, any challenges to exercises, anything. But imagine what you're able to do when these things are addressed. Foley had talked about even non-surgical procedures are options. Yeah. So let's do a wrap up. So Doc, I have someone who's watching who's like, yeah. I don't know. I'm a little embarrassed about this. You're in Atlanta. I'm in Texas. So I can't see you, and I'm a little nervous about this, but I feel like something needs to change. Any words of encouragement before we wrap up, Doc?
Absolutely. So yes, I think what I tell women is information is key. And so nowadays we're not limited by location. And so there's a lot of information online, but it's important to go to the right sources, right? Mm-hmm. And so I tell women, and I have a YouTube channel that I educate women through, and I also I like to educate women essentially online. So whether it's on Instagram or Facebook or YouTube, I perform videos to educate women. So I think it's important for women to go online, seek the information that they need, and there are urogynecologists everywhere. They're not necessarily like a superfluous amount, but there are urogynecologists in most places and states that, it may take some travel depending on where you live, but I think seeing someone who is trained, who can take care of you is very, very important. So you don't have to live or put up with it. And imagine how you would feel if afterwards you can then go to do things you enjoy and not have to suffer in silence. And so I tell women not to be embarrassed. It's not the easiest thing to talk about, but it is common, but there are good solutions that can be helpful. I think seeking care and being an advocate for yourself and being confident that this will work for you is very, very important. But I think online has opened up a well of opportunities for women to seek the information that they need. So.
All right, that's good, because that segues to a question someone has. Thank you so much for asking this. She says, how do we find local support in our city? Because you said we could do online, but Google is very
exactly.
Yeah. So any tips on how to find local support in your in our city?
Absolutely. So there's the American Urogynecologic Society. It is long, but if you typed in augs.com, augs.com, that is a website that has a lot of good information. That is our main specialty website, so to speak. And then there's a column that'll say find a provider. There's a column that'll say patients, and then you can click there, and that'll help you find someone in your area.
That is virtual gold. Thank you so much. I hope you got that. And I have a second step to that question. She says, I am 68 and I didn't know that I need to see a gynecologist anymore because I figured no more paps. What do you say to that, Doc?
Right. So in a woman who older, who doesn't need to have pap smears any longer, or a woman who's had a hysterectomy and doesn't need to have pap smears any longer, it is still important to get a pelvic floor exam because it's part of the well woman visit, a breast exam, abdominal exam, and a pelvic exam. That's part of the well woman visit. But it's also important because then that will be the opportunity, aside from just the exam, to have a conversation with your doctor. What's going on? About your health. How's exercise going? How's your nutrition going? And so we talked about foods, and that's the time to even bring up, because one of the other risk factors is constipation and straining with bowel movements. So making sure we have a diet that's rich in fiber, drinking enough water, exercising, getting enough sleep, all those things. And then it comes up, you're talking about sleep. Oh yeah, doc, I get up like 3 times in my sleep. That can then bring that. So that's a time to have a conversation with your doctor during that well woman visit.
This is so good. So good.
And that's why I love it, because women come in the room and they get educated after they leave. They're like, oh, they feel better even before we talk. But I think that information is important. I think the education is important, and a lot of women want to be heard and listened to and understood. And once they leave, for example, women who see me, once they leave the appointment with that feeling, they feel like everything is possible for them, and they don't have to live or put up with this. Yes, it's a common part of aging, but it's not a normal or necessarily you have to deal with it and suffer and age. Yeah, it's a ways to age gracefully, and comfortably and confidently. And a woman, her confidence is lifted, she feels better, and she can go and do the things she wants to do in this world, and really feel secure about that.
Wow, this is good. This is really good, and I'm so excited. I raised up my hands because I'm excited at what this could mean for people who are watching, those who are watching replay, that will watch, who are watching live now, how this could change your perspective of what's possible for you. So really, really important. You have to ask for these things and find a provider who's willing to do this, or at least open to have this conversation with you. But thank you so much, Dr. Foley, for coming. This has been very rich, and I've taken notes myself on how I can even give better care and point people in the right direction. So thank you so much for this.
My pleasure. And so, and for women who, I like to educate my patients, as I mentioned, online. So women can actually reach out to me, and if they want some help seeking who they should see, because it's one thing to just go online and go through a list of names. You don't know who's who. And so I'm willing to actually be helpful. I work and I live in Atlanta, Georgia. And so if anyone who is not local to my area, I'm willing to help them if they reach out to me through my website, www.drtugbiyele.com, or they reach out to me via social media. I'm at the Urogyne Doc, at the Urogyne Doctor. And I'm more than happy to answer questions and provide resources that way as well.
Awesome. And that was my next question. Where can people find you? So you're going to say that again. You're going to say that again. Where can people find you, Doc?
So I'm at the Urogyne Doctor on Instagram. So I can be messaged there and found there, videos and follow there. On YouTube, Dr. Folusho Stephen at the Urogyne Doc. So just as it reads, and I have a library of videos there and resources that women can watch. I've created videos on every topic. Recurrent urinary tract infections, prolapse, pelvic pains, problems with sexual function, prolapse, urgency, overactive, all the things. So it's there. And then my website has good resources information, and that is which is drtugbiyele, my last name.com. So there are multiple ways to find me, and look forward to serving women and helping.
He's all over the place, not in a bad way. Like he's all over, like he's on YouTube, he's on LinkedIn. You didn't say LinkedIn. And you're on YouTube, the Urogyne Doctor.
Yes,
he's correct. On Facebook.
And I'm working on even being more visible. But and then I do have a free pelvic floor guide and a free menopause guide, actually, because a lot of women don't know the things that they don't know, right? So a lot of women have things that they are doing that is actually making their menopause symptoms worse, or could make their prolapse, their pelvic floor work better. And so at the Urogyne Doc, there'll be a link. You can download that guide, and that should, again, as I'm an educator, a surgeon, and a family man myself, I'm here to serve women. That can be helpful to you. So looking forward to get that guide to you.
Awesome, awesome. And I put all of that on the comment. You can watch it, replay, and you see it. You have his name, and it's right there at the bottom of the screen, so you can look. These are useful information that you could use to help you and actually help advocate for your care. This has been awesome. Thank you so much. It's almost 8:30. Wow, time flew.
Right, that flew.
But we're going to have you come again. We're going to talk a different topic. I'll send you that link. I always like to ask live, so you can't say no.
Yes,
Okay.
I would gladly come. And Dr. Labita, thank you for having me. You're an awesome physician. I've watched how you've grown your practice and how you serve your patients and how you serve your team, how you love your team and how you love your patients and how you educate your population that you're caring for. So I really, I'm honored. Thank you so much for having me. And for those people who are watching, who are her patients or those who are not yet her patients, you're looking at the right doctor for you, family doctor who cares about you. It's not just looking to see you and get you out the door. So yes, you're blessed.
Thank you. I appreciate that. Thank you. Thank you so much. And for all of you who watch live and replay, I appreciate you spending your Saturday with us. As always, if you're looking for an awesome, thorough, and compassionate family physician who will help you live long and well, I am she. Have a good one, everyone. Thank you so much.
Okay. Thank you.
Bye.